Hello dear friends, how are you today? I hope you are well. Here we are going to explain another question about dermatology. A 60-year-old man is admitted to the hospital with acute pneumonia. He has a past medical history of chronic obstructive pulmonary disease, alcohol excess and hypertension, and has been homeless for the last 12 years. On the post-take ward round, you notice that he has a brown red discoloration of his face, neck, forearm, and lower legs, with scaling and cracking of their skin. He complains that he is struggling to eat and drink and has persistent vomiting and diarrhea. He seems a little disoriented. Which vitamin deficiency is most likely to be causing these symptoms? A. Vitamin B2 or riboflavin. B. Vitamin B3 or niacin. C. Vitamin B6 or pyridoxine. D. Vitamin B1 or thiamine. And E. Vitamin B12 or cyanocobalamin. Okay, here we have our 6-year-old homeless man with coming with acute pneumonia and chronic obstructive pulmonary disease, alcohol excess, and hypertension, which he was homeless for 12 years. It means that the patient's hygiene and nutrition condition is very low. Okay, on the exam we can see brown red discoloration of his face, neck, forearm, and lower leg with scaling and cracking of the skin. Okay, he seems a little disoriented. These all are signs and symptoms of pellagra or vitamin B3 or niacin deficiency. Here we are going to explain it. Okay, the answer is vitamin B3 or niacin. Deficiency of niacin or vitamin B3 causes pellagra. The patient has some of the symptoms of pellagra, which is classically characterized by their triad of dermatitis, diarrhea, and dementia. Okay, their dementia more commonly presents subtly with low mood, irritability, apathy, and anxiety, progressing to delusion, psychosis, drowsiness, and coma. Here we say the triad of dermatitis, diarrhea, and dementia, or 3Ds. We can say that we can say it 4Ds also, because the fourth one is for death. If the deficiency is severe and is untreated, it's finally result to death. That's why we can say that 4Ds: dermatitis, diarrhea, dementia, and death. Okay, pellagra. Pellagra is caused by nicotinic acid or niacin deficiency. The classical features are the 3Ds: dermatitis, diarrhea, and dementia, or we can say 4Ds: dermatitis, diarrhea, dementia, and death. If the deficiency is severe and remain untreated, the final result will be death. Okay, pellagra may occur as a consequence of isoniazide therapy also. Isoniazide inhibits the conversion of tryptophan to niacin, and it is more common in alcoholics, as we can see in this patient. Our patient is alcoholic. Features of pellagra: dermatitis, like brown scaly rash on sun-exposed sites, turn casel's necklace if around the neck. Diarrhea, dementia, depression, and death if not treated. Here we can see signs of pellagra or niacin deficiency in this patient. Here we can see casal necklace around this patient's neck. Here we can see glow and stalks lesions. It means that the lesion usually present in their sun-exposed area, in their area which the person usually use gloves and stalks. Okay. Here the mucosal involvement is common. Here we can see different lesions of niacin deficiency in this patient. Here we have also gloves and socks lesions. Okay, the source of vitamin B3 on niacin is usually meats, fish, and whole grain cereals, eggs, milk, and other high nutritious foods. Okay, here was a short explanation about the patients coming with different skin problems, dermatitis, diarrhea, and the signs of dementia with the diagnosis of vitamin B3 deficiency or niacin deficiency. Thank you for your attention.